Hello everyone, it's Dr. Dave. Hope you're all doing well, enjoying your week as usual, every single day of the week, hopefully. In fact, coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Thursday, June 24th, 2021. Going to look at 6 areas of health and wellness. Somewhere around this video, you can read through all 6 areas. If you have any questions or you'd like a copy, you can DM us on social, send us an email, or give us a call here at the clinic, and we'd be happy to get that to you. Always happy to lend a hand. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, we promised to share with you Monday through Thursday something that's going on in the research and literature with respect to health and wellness that might just stimulate some of your own thinking when it comes to your health and wellness or the health and wellness of those around you, and just keep that journey going in a positive way, right? So, very interesting to start. Something that I'm kind of surprised about because I think it's just such a strong habit and something that we learn early on. In the journal Spine, May 2021, they talk about not wearing seatbelts is the biggest cause of serious spinal injuries in teenagers. They did an analysis of data regarding pediatric spinal fracture patients, and they found that teens aged 15 to 17 years represented about 63% of cases, with roughly half stemming from a motor vehicle collision in which a seatbelt was not worn. Seems like something so everyday, but I guess we still aren't wearing those seatbelts, and according to the research, they can save lives. There's always an exception, or I guess some kind of debate, but I think this is just a matter of not, or choosing not to wear it perhaps, but always a good idea. So perhaps if you have youth around you or youth of your own, and it's good to reinforce that wearing that seatbelt is always a good idea. The journal Sports Medicine, May 2021, looks at protein sources that we usually are pretty particular about if we're looking at gaining muscle, but they say it may not matter that much. Young adults who participated in a 3-month resistance training program experienced similar gains with respect to muscle mass and strength, no matter if their protein primarily came from animal or plant sources. Maybe that does matter in some respect, and depending on what your approach is with your diet or your nutrition, that you can in fact maintain good muscle strength and growth even with plant-based sources of that protein. And there's a common thought process among people perhaps that the best source is to get it from animal sources because it's just the same as our source that we're trying to build, but plant sources seem to be just as effective. So if you have a certain diet or health strategy, then a plant source is okay if you're trying to build and or maintain those wonderful muscles of yours. Medicine and Science in Sports and Exercise and Frontiers, May 2021, talks about stair climbing and how that's great for heart patients. For patients who underwent a cardiac procedure, new research suggests that a stair climbing intervention is as effective for increasing cardiorespiratory fitness and muscle strength as traditional moderate intensity exercise. A couple of flights may be no big deal, but if you continue going up those flights, you will notice that it takes quite a bit of effort, and it does get your heart rate up, and probably gets you breaking a sweat a little bit as you keep going up floor after floor. So stair climbing, good for you, good for your heart. So get out there and park the car far away, walk a long distance to wherever you need to go, and instead of the elevator or escalator, consider taking those stairs. Very Well Mind talks about dementia in May 2021, the signs and symptoms of such. Dementia is an umbrella term that includes a variety of brain disorders associated with reduced cognitive function and a declining ability to live independently. Health experts note that common signs and symptoms for dementia include difficulty learning new information, solving problems, and completing tasks, irritability, depression, social isolation, paranoia, and anxiety, getting lost and misplacing commonly used items, and exercising poor judgment. Now, quite often, the individuals with the cognitive decline don't notice or see these patterns or trends in themselves as soon as maybe the people around them might notice those changes. So, if you live with or have friends and family members especially that you're keeping an eye on, you want to watch out for some of those signs and symptoms. There may be some lifestyle strategies and other medical or health interventions that can help support what you may notice as a change of concern. So it's good to get out and seek some guidance from qualified health providers in that respect if you notice some of those changes, just to be sure that a source or a reason can be identified as necessary, right? Quite often on the Daily Health Update, someone provides us with tips on healthy living, a healthy lifestyle. This time they're coming from Indiana University, May 2021. They suggest that in order to maintain a healthy lifestyle, weight, and well-being, you should do these things. Measure and watch your weight by tracking your body weight on a daily or weekly basis. Limit unhealthy foods and eat healthy meals. Take a multivitamin supplement. Drink water, stay hydrated, and limit sugar beverages. Exercise regularly, reduce sitting and screen time, get enough good sleep, limit alcohol intake, and find ways to manage stress. So nothing new perhaps in that list. However, good to confirm and reaffirm for us that anytime we make an effort to try and tick those boxes off, those healthy things we can do for ourselves, the research says we are going to be better off. So just some encouragement to keep up the effort. Sometimes it's not easy as our lives get busy, but we should always be able to try to make and find some time for our health and wellness, like you are if you are watching this right now. So good for you. The Malaysian Orthopedic Journal, March 21, 2021, talks about bowling and upper extremity disorders. Examinations of 39 national level bowlers revealed that more than half have Descraven's tenosynovitis in their dominant arm, a common overuse injury of the wrist. The bowlers were also more likely than the general population to have conditions like tennis elbow, carpal tunnel syndrome, and trigger finger in their non-dominant arm. And of course, manual therapists are able to help keep those arms functioning well. So if you or someone you know is a bowler or has some other musculoskeletal problem that is affecting the arms, good to seek out some care and improve how those arms are working. It'll keep you in the game, whether it's the game of bowling or the game of life, or perhaps with your occupation. And maybe if you're fortunate, you're enjoying bowling as your occupation. That would be amazing. But there is help to keep you going. So get out there and make sure you get some help if you notice some problems. All right, so that's your daily health update for Thursday and the weekend coming up. Hope you enjoy it. Tomorrow we'll have a written format posted for you, the daily health update. We'll get you through the weekend with that, and then we'll catch up with you next Monday with another video daily health update. Take care, have fun, go out there and enjoy that nice weather, and we'll talk to you soon. Stay well.